Welcome to ACT Webinars for Healthcare Professionals. I'm Robin Geiger, Chief Nursing Officer for Ingenovis Health. Excited to introduce and welcome our guest back today, and I'm looking forward to his talk on men's health and wellness. Dr. Shedrick Shields has over 24 years of experience in nursing with extensive backgrounds in family practice, primary care, nursing education, and leadership. He holds a PhD in nursing from the University of Phoenix and is board certified in family practice. He also holds an autonomous practice license in the state of Florida and is the owner of Mobile Practitioners Group, a home-based primary care company in Florida. He's an assistant professor for the School of Health Professions, Department of Nursing at National University. And in addition to all of these accolades, he is a member of Sigma Theta Tau International Honor Society of Nursing, Omega Psi Phi Fraternity Incorporated, and several other fraternal organizations that promote health, wellness, and community engagement. It is my pleasure to welcome Dr. Shedrick Shields.
Thanks, Dr. Geiger, for that wonderful introduction. You always make me sound much better than I really am, and I really appreciate it. And I'm really happy to be here this year again to cover, topics in men's health. It's a very important topic that doesn't get discussed a lot, and I'm very happy that you have invited me to cover some things that are very important and vital for men in the area of men's health. So again, my name is Dr. Shedrick Shields, as Dr. Geiger mentioned, and today's topic is going to be men's health, navigating strategies for wellness. And again, what we're going to get into is just some simple strategies, guidelines on preventative health and wellness, ways to stay healthy and to hopefully prolong our lives. I want to start out by saying, everybody, happy summer, right? Today is the start of the summer solstice, June 20th. So, what a great day to have this webinar. Typically, summer starts on June 21st, but this year it started on June 20th, which corresponds to our webinar. Uh, with summer coming up, everybody, of course, has new goals, right? Most men, we have new weight loss goals. We want to improve fitness and we want to gain better control over disease and illness. And if those aren't your goals, hopefully after today's webinar, they will be your goals. Because without health and without wellness, of course, we can't live, a vital and robust life. We're going to start off with, a discussion on preventative health care, right? Preventative health care includes issues like disease prevention and health promotion. There's a big difference between preventive health and, of course, disease treatment. Preventative health is when we're catching things before we're symptomatic or we're preventing them from happening. And so that's what preventative health is. Health promotion includes things like immunizations, screening for early diseases, and education and counseling. And in health promotion, we want to do exactly what that says, right? We want to promote health, promote health and delete and decrease illness and disease. All right. And in preventative healthcare, of course, is important because it ensures that asymptomatic disease and illness are discovered. So we wanted to detect these things that aren't impacting us, those silent things, such as colorectal screening, screening for lung cancer, hypertension screening, things like that. We want to catch it before we're sick. And typically in men, we don't go to our healthcare providers, of course, until things happen. So I want to encourage everyone to, to use preventative healthcare and disease prevention. Weight management, right? Weight loss. Weight loss is important. It's a big topic nowadays, especially with the new drugs to decrease weight, the new shots, the Ozempic, the Wegovy, all that stuff is real popular now. So weight loss is very important. And of course, with the invent of those drugs or the discovery that those drugs increase weight, we've been having a lot more conversation about it. And so healthy weight loss is 1 to 2 pounds per week. A lot of the fad diets, of course, promote, 5, 10 pounds a week, 3 pounds a week. That's really too much. You want to set your weight loss goals to something that's attainable. and 1 to 2 pounds per week of weight loss is appropriate, and it doesn't really put you at risk for anything else. And most men, you want to know your BMI. The BMI is the body mass index, and we'll go into a brief discussion of what that is. But that's typically what healthcare providers will get on you when you go to your physicals and your acute care visits. And we'll discuss BMI a little bit as we move forward. And what is their end game, right? Our end game is health, fitness, and some of us, just want to look good, right? Aesthetics. When you get a little older, like myself, you're not trying to win a triathlete, a triathlon, or you're not trying to go to the Olympics or make it pro. You just want to look good, right? You want aesthetics, but that comes with health and fitness. If you're healthy and you're fit, you'll have those aesthetics that you want, right? And again, you want to set these realistic goals. If you're right now you're weighing 220, uh, don't expect to be weighing 200 pounds at the end of the month. That's really unrealistic, and sometimes that can frustrate you on your weight loss goals. Set realistic and attainable goals. If healthy weight loss is 2 pounds per week, if you're starting at the beginning of the month, a good goal would be to decrease your weight by at least 6 to 8 pounds a month. All right. And always, of course, consult your healthcare provider or your nutritionist or your dietitian before you start any weight loss journey, right? You want to make sure that your liver, your kidneys, everything is functioning well, and you're in the right condition to embark on a weight loss journey. Body mass index. I mentioned that in the last slide. So the formula for body mass index is here. It's a complicated scientific type method. But what we do is we calculate your weight divided by pounds by height in inches. All right. Squared and multiplied by in the conversion factor of 703, which is pretty complicated, right? But we all have apps now on our phones and things like that to determine your body mass index. But basically, it's your weight divided by your height uh, times 703. But we have calculations for that. All right. So that's your body mass index. And that's a quick, fast way for us as healthcare providers to tell whether or not you're at a healthy weight, or you're not. All right. And so here's more simplified, I'm sorry. Here's a more simplified chart on body mass index here. Your BMI is your weight in kilograms over height squared, blah, 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 right? And here's the categories of BMI. So if your BMI is greater than 30, that means you're obese, right? Anything in between 25 and 29.9 is considered overweight. And normal weight is 18.5 to 24.9. And you're underweight if you have anything less than 18.5. All right, so our goal is to fall into that normal weight category with a BMI of 18.5 to 24.9. That should be the goal for both men and women, right? And even there are some variations and some outliers, of course. You really fit dense muscle, uh, dense bone ethnic groups or men. Sometimes their BMI may not accurately account for how healthy they are and whether or not they're obese, because you have to consider their muscle mass as well as their bone density. All right. But this is just a quick way for us to know whether or not you're overweight, obese, or over normal weight. All right. And in order to get this BMI together, of course, of course, exercise, right? Exercise is number one. It's a must, right? Exercise is a must for sustainable weight loss. You can't do a quick fix diet or weight loss program and not exercise and expect to keep the weight off, right? Exercise, of course, you got to adopt it. It's a part of your lifestyle. Exercise needs to be, something that you consistently do, right? Uh, 30 minutes most days of the week, which is, at least 5 days a week. 3 to 5 days a week, you at least need to get 30 minutes of increased heart rate exercise that causes you to sweat, right? Or weightlifting or resistance training. Okay. Uh, so at the very least, you need to get at least 150 minutes a week of moderate to intense aerobic activity, right? And 2 days a week of resistance training. All right. Uh, Most people when they start their weight loss journey, exercise journey, they want to do a lot of cardio. But studies have found out that weight resistance training can be just as beneficial as only doing cardio, right? Lifting weights now, because the more muscle mass you build, the longer you're able to burn calories when you're not exercising. So, at the end of the day, exercise is a must for sustainable weight loss. You need to make it a part of your lifestyle, right? It's 24 hours a day. So always, mark out that time to exercise. There's 24 hours a day. We may work 8 to 10 hours or 12 hours. If you're in healthcare, if you're a nurse, 12 hours, but you still have 12 more hours. You can get your 6 hours of sleep, 6 to 8 hours of sleep. That still leaves 4 hours to be able to get, that 30 minutes of exercise and resistance training in. So I encourage everyone to do that. All right, on to more preventative measures, vaccinations, uh, flu vaccine. Everyone should get that, especially, and men in particular, we need to have that age 19 and older. We get the flu vaccine annually, right? The flu vaccine, of course, doesn't prevent uh, you know, all incidences of flu, but it decreases it somewhat for from individuals uh, who who could potentially get ill. So I encourage the flu vaccine annually for everybody, whatever formulation it is. I encourage you to get it. And of course, unless you're allergic, allergic to some of the ingredients. And any of these recommendations I make, if you're allergic to it, don't do it. And of course, you need to consult your personal healthcare provider before implementing any of these strategies. All right. So your pneumonia vaccine, I would recommend that at age 65 and older. All right. It's once if you use the PCV 15 formulation. And if you use the other, you should be doing another dosage a year after. The shingles vaccine, there's been a lot of talk in the media and around the past 5 years about the shingles vaccine. That's recommended at 50 years and older. It's a two-dose series, 2 to 6 months apart. So we encourage the shingles vaccine, especially if you've had um, chicken pox, as a younger individuals, because what the shingles is the chicken pox virus coming back out, and that typically happens in immunocompromised individuals or our elderly population. All right, so we encourage the shingles vaccine. Get that at age 50 years or older. The HPV vaccine, if you're uh, aged teenage to age 26-year-olds, we encourage you to get the HPV vaccine. Parents, fathers of your daughters and sons, I encourage you to get them vaccinated before age 26. Studies have found that most men and women have HPV, and so it's very prevalent. But the thing is, men, we're the carriers of it, and typically we don't have any symptoms, and we end up passing it on to whoever our partners are. And once women get the HPV virus, some strands can cause cervical cancer. And so that prompted the invention of the HPV vaccine, and thus now we promote for those teenage to 26-year-olds to get the HPV vaccine. All right. I want to stop here quickly and just get a pulse check um, on um, on some of the ideas that men have about visiting their healthcare providers. Dr. Geiger has a poll that we want individuals to participate in. I just want to get a pulse check. So we'll do pulse check one, Dr. Geiger. So, seeing the healthcare provider, as I mentioned earlier when we started at the beginning of the webinar, is that typically men, we don't go to see healthcare providers regularly unless, of course, we're ill or we're sick. So that question was in there to, kind of get an understanding, an idea of um, what you guys thought and how you uh, perceived, or how often you go to see your healthcare provider. When was the last time you seen your healthcare provider?
I did have a
But in general,
few,
you,
Dr. Shields, I had
yeah,
a few people try to answer, and the consensus was that they typically going once a year.
okay, all right, good. Well, if that's the consensus. That's great. So once a year is fine for your normal healthy male. you're young, healthy male. But if you have, if you're a little bit on the older side like myself or have any health problems, you should at least be going at the minimum twice a year, every 6 months. But once a year is fine. If you're healthy, your healthcare provider's seeing you, you've had your lab work for the year, and they think you're good to go, once a year is fine. But as you get older, at least twice a year minimum, if you're a healthy over 45 to 50-year-old, I encourage you to go at least twice a year uh, for a checkup. But annual physical once a year, and I encourage everyone to do that. All right, I'm going to move on here. All right, prostate cancer screening. Um, prostate cancer screening. The general consensus and studies have shown that the PSA testing we were doing and the digital rectal exams we were doing, they were causing more harm than they were good. So now it's recommended that uh, men consult with their healthcare providers before even uh, participating in prostate cancer screening. They come up with this because prostate cancer is typically a uh, slow growing cancer. Men typically die of old age or natural causes before they die of prostate cancer. They found during the study that the screenings did more harm than they did good. Right? There were a lot of false positives in the test. There were a lot of just bad experiences, and it really didn't decrease the morbidity and mortality of prostate cancer screening. So now the recommendation now is if you're a man ages 55 to 69, they want you to discuss with your healthcare provider before engaging in a prostate cancer screening. But if you do, the test is called the PSA test. It's a blood test that we use to detect the antigen in your blood. And typically, the higher that antigen is in your blood, the more at risk you are for prostate cancer. Um, but the test isn't that specific. So that means that just because your PSA is high, that doesn't necessarily mean that you have prostate cancer, right? And so what you want to do is follow up with your healthcare provider, talk with them about your risk, and do you and him or her decide whether or not it's beneficial for you to do the screening. But I highly encourage anyone who has a family history, of prostate cancer. If your father, your grandfather, close relatives had prostate cancer, I would encourage you to, participate in screening or discuss with your healthcare provider what you should do as far as screening is concerned. But nationally, in general, it's a discuss with your healthcare provider and go from there. All right. Colorectal screening. Right? So colorectal screening, of course, that's when you're screening for colon cancer. Uh, Many men, myself included, and a lot of my friends are reluctant to do colon cancer screening, right? Because it causes, the screening, uh, the the recommended screening uh, um, allows for a doctor, of course, to have to look up your rectum to actually visualize your colon, right? And so, of course, many men are reluctant to do that. But you should be screened annually, ages 45 uh, to 75, not annually, I'm sorry, but ages 45. They recommended your first colorectal screening should be at age 45. It should be older if you have a close relative that had colon cancer. So if you have a father, grandfather, close relative with colon cancer, you should be screened at age 40. All right. But if not, at least at age 45. Uh, Typically, once you have your first screening, if your screening is good, the gastroenterologist usually tell you to come back in 10 years. If they find polyps or something abnormal during the during the screening, then they'll have you come back sooner. All right. But the recommended age for colorectal screening is 45 for men, and if you have a close relative who had colon cancer, it's age 40. And so what they do, of course, is they put a probe, up your rectum into the colon, and they actually visualize the colon to see if there's any any signs of cancer or things like that. They also have some other screening tests as well. The fecal occult blood test. That's when they get like a small sample of your stool and they test that for occult blood. Uh, and that's what you see with the Cologuard. There's a lot of commercials with the Cologuard where they mail you this packet, and what you do is you have a bowel movement, you put stool in the packet, and then you mail it back to them, and they test that for blood. But if that tests positive for blood, then you still have to go back and do the colonoscopy. Right. And the colonoscopy is the test that we talked about before. All right. So we encourage all men 45 and up, go and see your primary care provider and have them refer you out to GI so you can do your colorectal cancer screening. Lung cancer. So we got lung cancer. It's the second most common type of cancer in the United States, right? And it's the leading cause of cancer death. All right. And cigarette smoking, of course, is the number one cause. Uh, it can also be caused by, pipes, cigars, secondhand smoke, exposure, occupational hazards, things of that nature. All right. Uh, so with that said, of course, we want to encourage and discourage smoking and encourage uh, uh, others to quit smoking. All right. And this is just some information for uh, people who have smoked. The 1-800 quit now. If you call those, if you're a smoker and you call that hotline, they'll usually set you up with a like a smoking cessation kit, and they'll get you some. Usually they'll hook you up with a provider and get you some medicines and some tools to help you quit smoking. Smoking, of course, is a risk factor for anything. If it can cause anything, smoking is it. Lung cancer, colon cancer, kidney cancer, cigarettes. Cigarettes are nasty, nasty habit. That as well as cigars. We're seeing the cigar bars, they're more popular now, and everybody's smoking the cigars. Smoking one cigar is the equivalent, I think, of 10 to 12 cigarettes. But you hear most cigar smokers say they don't inhale, you're inhaling something. So, even though it's a cool and novel thing to do now, I highly discourage cigars and hanging out in these cigar lounges, right? Because you're getting secondhand smoke and all of that stuff. It's a cool thing to do, but uh, you know, in my estimation, I think we're going to start seeing a lot more uh, incidences of lung cancer and COPD here in the next 10 years because of everybody because of popularity of these uh, cigar clubs and cigar bars now. Uh, you know, so I discourage that. Avoid your secondhand smoke. Avoid cigarettes. Avoid cigars. If you're smoking, call 1-800 quit now, and they have some wonderful resources for you. All right. So screening for lung cancer is something that we typically don't do. The preventative health disease promotion part of uh, lung cancer prevention, of course, is just teaching, right? Teaching and encouraging individuals not to smoke and discouraging those who are smoking. All right. Uh, there are some things you can do. Of course, you can do a CT. They recommend a CT, men ages 50 to 80. But typically we don't do any of those tests until, uh, you start having symptoms. So to decrease lung cancer is typically counseling. Counseling is what we do. And of course, we remind you every time you see us that smoking is detrimental to your health. All right. If you're a male and you got a friend who's smoking, nag him, hey, you need to stop smoking. Smoking things, how many cigarettes you smoke, how many cigars you smoke, you know, be a nuisance. You want to discourage that habit because if anything can cause anything, it is smoking. All right. And last but not least, of course, the importance of family and friends, right? Encourage others to see their healthcare providers for screening. Like Dr. Geiger in the poll we had earlier said that most of the guys on this webinar said that they see their healthcare provider at least annually. I want to recommend at least annually, but if not annually, uh, if you're older, a gentleman, at least twice a year. But as you see, if you see a healthcare provider annually, he'll schedule you a follow-up appointment based on your health and your health risks, right? So we encourage annually, and then once your healthcare provider sees you, him or her will discuss how soon and how often you should follow up with them. All right. If you're out there, attend your healthcare provider visits with family and friends. Uh, if you're a male, guys, I encourage you to bring your wives or bring your partners. Have somebody in there with you doing your healthcare visits. Sometime maybe they aren't as uh, reluctant to speak to the healthcare providers, and maybe they understand things that you don't understand, right? And if they're there with you, once you leave, maybe they can encourage you to go back if it's something that you need to have done, right? So attend healthcare provider visits with your family and friends, right? Schedule screenings for your spouse. Uh, this is very important. I find, and studies have found that wives, girlfriends, and spouses typically are the most important uh, guides for getting men to the healthcare provider. All right. So I encourage you, if you got a family member that hasn't been to a healthcare provider, get on the phone and schedule a visit for them. Have them opt out instead of opting in, right? Instead of asking them, hey, have you seen your doctor? Why don't you call them? You tell them, hey, I'm going to call and schedule you an appointment. You need to be seen. Call the visit and have them opt out. Don't have them opt in, right? Stress the importance of prevention and screening to your youth, right? All your men, stress the importance with your sons and your daughters also on the importance of prevention, right? Importance of exercising, importance of eating healthy and balanced diets, and the importance of seeing healthcare providers, right? We have to get away from the fear of seeing healthcare providers, and get them used to being seen because if you want to live a healthy life, you're going to need to somehow get in to see your healthcare provider so they can help assist you. All right. And disseminate facts, not myths or folklore, right? Uh, there are a lot of myths about certain vaccinations, certain procedures, right? If you don't know, ask someone who knows. Ask a healthcare provider, right? Don't use Facebook or Instagram or any other social media type things for your information. Go to reliable sources. Get your information from the CDC, uh, real reputable sites, right? And if it's something you're unsure about, ask your healthcare provider, right? Ask your healthcare provider and share your positive experiences with the healthcare providers. Studies have shown that a lot of men don't go and see the healthcare provider because they're scared, they're reluctant to discuss their problems, and maybe some problems that they're ashamed of, or they're just scared of the procedures, right? Scared of the unknown, right? I want men, as men, we need to share, with our family and our friends, our male counterparts, some of the good experiences. Hey, I went to see Doc so and so, and everything was fine. He talked to me about prostate cancer. He recommended this. He recommended that, and I'm glad I went. They caught this. They caught that. They said everything was fine. It wasn't that bad. And encourage your other friends to go and see their healthcare provider. All right.
The first question is thoughts on meal kit and prepared meal delivery services. Are there benefits or drawbacks? I'm considering it because it seems like an easy way to keep track of daily calories, protein, etc.
All right. Meal kits. Meal kits. Uh, they're a good thing. I have mixed feelings on them, right? They're good. It all depends on what your goals are. Like, what are your goals? Is it do you want to lose weight? Are you trying to bulk up and get muscle mass? Are you training for something in particular? Uh, they're great for those types of goals, but it all depends on your goals because yes, they already prepare, they put them a certain amount of protein, carbohydrates, and whatever it is you need
Mhm.
in the meal kits, and that's fine. The only downside of that is, what about when you stop using the meal kits? Will you be able to prepare these meals on your own? Right? They should be used as, uh, I would use them temporarily for whatever goal it is you have at that particular time. But while you're doing the meal kits, you need to be learning how to prepare these meals on your own, right? Because I know they're expensive. Most of these kits are expensive.
Yeah.
And my question to you is, what are you going to do when you don't have the money to do it, or when when you get tired of
Okay. Can you still hear me now?
it? Yep.
Okay, great. So that was a really good question. And the other question was about the shingles vaccine. And if you've already had an instance of shingles, can you still have the vaccine? Like if you had one, what, I mean, and I don't know if you've seen this in your practice, but I've seen like 26-year-olds and 32-year-olds, and they're getting younger and younger sometimes. So is it okay still for them to have the shingles vaccine?
Yes, yes, you still can get the shingles vaccine. Of course, you can't. They don't recommend getting the shingles vaccine while you have active outbreak of
Right,
shingles. But
right,
once that episode is resolved, you can still get the shingles vaccine, and I recommend that you still get it because you can get shingles. You can have more than one outbreak of shingles. It's not like it's a one-time deal and it goes away
right,
and you never get it again. So yes, you can uh, get the shingles vaccine if you had shingles prior.
right. Okay, and then there was a question about the flu shot. Some people are just scared of needles and they're scared of getting the flu shot. I'm one of them. Not me. This is the question, but I don't like needles. Um, but the question was, do you really have to get the flu shot, or can you just be very healthy and wear your mask and wash your hands and avoid the flu?
You should be doing those things anyway, right? You want not wearing your mask, right? But you should be washing your hands, using your
Right,
hand sanitizer, doing those types of things anyway. But yes, I still recommend the flu and get the flu shot annually. It's not a 100% type deal. But, if you do end up coming in contact with the flu, it will at least, decrease the symptomology of the flu. But, if you're just super scared of the flu, super scared of the needles, then I totally understand. But
right.
I encourage still getting the flu shot annually.
Okay. Two more. The next one was um, about protein and kidneys. Like if someone's trying to bulk up and build muscle and adding a lot of protein to their diet every day, does that really affect your kidneys? There's some concern about that.
Like I mentioned during the webinar, make sure you check with your healthcare provider right before you
Right,
start any of these high
right,
protein, low carb
right,
diets, any of these diets. Make sure you see your healthcare provider and you get some lab work done, right? You want to make sure your liver and your kidneys and everything is functioning correctly to be able to uh, metabolize these nutrients. So check with your healthcare provider before you do any of those high protein, low carb, or any of those diets. But yeah, if you have healthy functioning kidneys, it's okay. You just got to make sure you're drinking enough. Drinking enough water, staying hydrated, drinking enough water. Your body, you typically will get rid of what it doesn't need, but you need to make sure that everything's functioning correctly before you start. You'll typically only run into those problems if there's a problem before you start, right?
mhm,
If your kidney function is low, and you got some problems metabolizing protein, then you'll probably run into some problems. So that's the importance of seeing your healthcare provider regularly, and so
mhm.
you can know whether or not you'll be able to tolerate that.
And the last question was about the prostate screening that you mentioned. What was that? Like I think they wanted to know it's PSA or prostate specific antigen is what that stands for. And then is that enough? Do you have to have the manual exam? Can you just do the blood screenings?
Typically, just a blood screening, unless there's a real reason for your provider to go in and do the digital rectal exams. That's kind of why they changed the recommendations because they were doing a lot of digital rectal exams and doing a lot of screenings, and it still wasn't detecting
Right,
prostate cancer. There was more harm,
right.
being done than good. But no, if you do have anything, if your provider does recommend any test, it's typically just the PSA screening. Then if that's high, so if you come to a guy like myself, primary care family practice, and we discuss things, you're high risk for prostate cancer, I'll do a PSA on you. If your PSA is high, then I'll typically send you to a urologist and they'll take it from there.
Okay. Well, Dr. Shields, I've enjoyed hearing your talk today. We thank you for joining us again. been a pleasure having you. And we certainly hope that you will join us next time. And we thank you for attending. So, is there any last things that you'd like to leave with everyone?
Hey, let's make this summer. It's going to be a hot summer, so I want to encourage everybody to stay hydrated. If you're going to exercise, make sure you're drinking a lot of fluids. Exercise if you're in Florida or some of these really hot states. Try to exercise early in the morning or late afternoon. But let's get at it. It's going to be a good hot summer, so let's get fit.
Thank you so much. Okay. Thank you, everyone. Join you next time.